Welcome back. Now, at this time of year, one thing we need to make sure we take care of is our health, overall well-being. And we are so in tune with our well-being right here on Wake Up Nigeria that we decided for health this month, we make sure you are feeling optimal. But how's your waist feeling this morning? Is there a little bit of stiffness, any pain, any aches, any strain? Maybe you've not been managing it the right way. On our health segment this morning, we're joined by Professor Adewale Baderinwa Sunday. Now, he's an alumni of International University Medicina Alternativa in Ceylon, Sri Lanka. Now, he got his Bachelor's of Medicine there, and he traveled the world to become one of the leading experts in medicine and acupuncture. Today, we are exploring waist pain.
Yeah.
You are welcome back to the show, sir.
Thank you.
Now, my colleague, Mary, had some interesting testimonies of what you were able to achieve in the conversation you had last week.
Yes.
But for those that didn't hear from you, let's just give a brief overview of how acupuncture works and how it impacts waist pain.
Well, acupuncture works in, let me say, they say it's miraculous. It has saving effect. A lot of people believe acupuncture is just to relieve pain, but it does more than that. Acupuncture has what we call immune-enhancing capability. When your immunity is low, acupuncture can revitalize it. Acupuncture is also good when we talk about motor recovery. In other words, when you are losing sensation in some part of the body, acupuncture can restore it, especially if the nerve is not damaged. You know, if nerve is damaged, it's irreversible. But if there is a blockade, acupuncture can fix that. Then acupuncture has what we call homeostatic effect. That is the ability of the body working parameters to function at equilibrium. Take, for example, if you are not breathing properly, you didn't have homeostasis. If your blood pressure is shooting up, you don't have homeostasis. I think there is going to be, maybe in my next topic here, we are going to really talk about hypertension. How can it be managed? So many things like that. Acupuncture also has the ability to be able to allow people to give birth without CS. If the baby is malpositioned, acupuncture has the capability to turn around the fetus in the womb. This sounds too incredible, but that is acupuncture for you.
So, obviously, once you've started talking about childbirth, one of the key issues during pregnancy is strain around the waist.
Sure.
And, of course, lower back.
Yeah.
So, waist pain and lower back, what is the most common cause of this? And how can it be avoided?
Yeah, both of them are very common. Most of us in our day-to-day activities, we tend to abuse our back. Take, for example, in sitting position. Your sitting should be that you maintain this angle 90.
Okay.
But many of us will sit like this.
Okay.
The Yoruba call them Shanu Dife Ijoko.
Wow.
In other words, spare the back and sit with your, spare the buttock and sit with your back. All this one will have effect on the back as time goes on.
So if you sit in a slouching manner.
Yes, you must sit properly. You must, when you are driving, your back must be well aligned.
Straight.
And when you sleep at night, your mattress should not be the sagging one. You know, because of the poverty in this land, when your mattress is sagging, you're supposed to change it. But people will turn it. And so when you do that, you'll be spending money buying pills every day, you know. And then postural defect, I've talked about that. Yeah. Then another one could be unresolved infection. When you're having an infection and you didn't take care of it properly, you could have waist pain.
Let's touch on this infection thing. Because a lot of people, we've discussed once in a while about, changing your mattress, even adjusting your chair in the office. But you say infection.
Yes.
How does an infection get to the waist?
When you have STD, for example, most of that region is located in the stomach area. And you know that the stomach is adjacent to the back. Okay. So it's going to affect the lumbar especially. Okay. You know, people will say it is lumbago. Yoruba will say it's jedi. You know, all those kind of things. So all these things, and then if you don't know the diagnosis, if you don't know the cause, then you start indulging in self-medication. You start taking all sorts of pills. And don't forget that these pills too, they have their very terrible side effects, especially NSAID, non-steroidal anti-inflammatory preparations. If you're having ulcer, you know you can't take it. But let's say you have ulcer and you're having waist pain, what are you going to do? Acupuncture. We fix it.
Acupuncture seems to be an interesting solution.
It is.
Now, you have a model here.
Yes.
On the table.
Yeah.
And it has so many markings.
Yes.
May I turn this guy around?
Yes, you can.
So that you can... All right, so
yes.
from the back.
Yes.
Here, we can see
all
from
those
the back.
lines you see.
Those markings on the
Yes, all those lines you see are what we call meridians or channels.
Okay.
They are the energy pathways. Then you see some dots in there.
Yes.
Those are the acupuncture points.
Okay.
Those points work miraculously. Now, when we talk about waist pain,
Okay.
if you don't mind, if you go to waist pain directly, acupuncture has been one of the best therapy to manage waist pain. It is very fast. It doesn't have any side effect. It has instantaneous effect. But when you want to manage waist pain in acupuncture, you are going to use just 3 points. You know we have over 1,000 points there, but the acupuncturist knows the efficacy of all those points. There are over 1,000 of them. But when you want to manage waist pain, you are just going to use 3 of those points. Those 3, we have one at the back between L4 and L5.
Okay.
We have one at the popliteal crease. Popliteal crease is that hole behind your knee. When you stand up, you see one hole there.
Yeah.
At the center of it is popliteal crease. Then we have one at the lateral malleolus and the Achilles tendon. So those are the 3 points that are going to be used.
So a lot of, okay, so anytime I've seen videos about acupuncture, for some reason I've been seeing them in the same area you find health spas, maybe hot stone massage, and all sorts of therapies like this. And it tends to feel like a luxurious kind of therapy. Maybe because it's considered expensive.
It is not expensive.
So?
You know all these things you mentioned, they are part of complementary medicine.
Okay.
So that's what makes it unique. I will say without any apology to anyone that complementary medicine sometimes starts where Western medicine stops. And that is why we are preaching integration.
Okay.
We should integrate. For example, if you have been having waist pain, you've been to your doctor, he has given you pills to swallow, you've been to your physiotherapist, you are not achieving much. The next thing to do is to turn to acupuncture. Acupuncture has that finesse, and that is why it is being utilized by sportsmen. Remember, I worked with Super Eagles for so many years using these needles. They work incredibly. I was just talking about the waist pain. Chinese, in their wisdom, they've been able to link waist pain to low sexual drive. If your back is not good, you'll not be able to fulfill your role matrimonially. So those points that are located can also be used to treat sexual weaknesses, like loss of libido. And those points, like I said, we call them, in acupuncture, we call them 3, 40, 60. We call them cocktail points. 3, 40, 60. Where does the 3 comes in? In that 3 is located on, we call it do 3. The do 3 is located here at the center of the back. Okay. You know, at the center of the back here, which we call center of gravity. And the Chinese call this point Yao Yang Guan. Yao Yang Guan. That's what they call the point. Then the one on the popliteal fossa here is called waist song. It's on UB40. Then the one on between the Achilles tendon and the lateral malleolus is called Kunlun. That's what makes it 3, 40, 60.
So now there's someone watching here now who has just been introduced to acupuncture.
Yes.
I would like to touch this needle.
Please do.
Now. So I'm looking at these needles. Let me see if I can hold them steady, hold them still.
You can even cut it and bring it out.
I can bring it out?
Yeah.
So these needles have, they're not the average needle.
Yeah.
Let me see if I can open that.
Yes, you can open it.
Okay.
Good.
So this
That is the needle holder.
This is a needle holder.
That's the needle.
And that's the needle.
Yes.
Let me put it in there now.
Yes.
Okay. So this is,
Let me demonstrate the use of the needle holders to you.
Okay,
where's the needle holder?
Oh, sir.
The needle holder?
The needle holder is right there on your hand, sir.
Okay, this is the needle holder.
I'm not a big fan of needles.
Yes,
I'm going to say that.
Okay, I will not needle you. But I'm not going to needle you.
Yeah.
I just want to give an example. If you want to needle a patient, you are an amateur, you put the needle holder like this.
Yeah.
You allow the needle to fall, then you tap. When you tap, the needle goes in.
Okay.
But I wouldn't need to do that since I'm an expert on it. That is the...
So the fear of needles is a real thing.
But in acupuncture, the needles are painless.
Okay.
When you insert the needles, you don't feel any pain. That is if you are well-trained like me. So when you insert the needles, you don't feel any pain. But you will feel sensations.
Sensations of relief.
Sensations of the fact that something is happening in your body.
Okay.
We call them subjective effect. The Chinese call it dachi. You will feel that something is happening in your body. It's different from when you take injection in the hospital. You know, when you take injection, you don't feel that in acupuncture. But you feel that some things are happening in your body. And then, miraculously, sometimes the symptom disappears.
Prof,
like I did there last week.
I honestly, and she gave us an interesting testimony, and I said, yes, we're going to have this conversation today.
Yes.
I've been able to see the needle myself, and it is tiny, it is bendy, it is light, it's nothing to fear at all. I am actually really impressed with myself that I'm even this close to a needle, because I'm not a big fan of needles.
That's right.
But I am interested in finding out more about it. Please ask your questions and contributions with the hashtag WakeUpNigeria on TVC and all social media. Please ask your questions. We'll see what we can do. Thank you so much, Prof.
Thank you.
Thank you. We'll see you again next week.